Hey everyone, this is John Hansbrough. I'm really excited to share with you a little bit today about something that I think it's a little tongue-in-cheek to talk about. I know it's a little funny if you saw this and you saw, I don't think I've seen a business webinar that uses the term suck in it. But, frankly, I think that's how sometimes people talk about their benefits. Sometimes that's how employees or prospective employees talk to one another. It's what they're sharing in chats as we'll look at. It's how people, frankly, view their benefits sometimes. And when we're really looking to help the companies that we work with best, that's when those companies are looking to turn benefits into a competitive advantage so they can build the team they need to take their business to the next level. You can't do that if your health insurance sucks. So today's webinar is going to be a really quick dive on why exactly health insurance can sometimes suck and then what you can do about it. So we're going to look at a couple different things going on in the general economy, some things about how healthcare has evolved to where it is today, and then some ideas for you as you come up on, the next time you're going to make benefits decisions, that you can make a change about that. So let's just dive into it. So to start with, I like leading with this. This came up recently with a client of mine. If we don't improve our benefits, we won't be in business 5 years from now. This was a conversation we had maybe 4 months ago, 5 months ago at this point. I was pretty surprised when he said this because, frankly, it sounds like it's coming out of some marketing materials, but it's so true. For a lot of the companies that we're working with, they're working to increase margins. They're working to increase top line revenue. They're trying to pay their employees more. It's a tight labor market. I know there's some layoffs going on right now, but still, if you're in the business of hiring people right now, you understand just how difficult it is trying to bring in new team members. You know exactly why that is. You know exactly how hard that is today. And so as we look at this, one of the things that comes up, what people are saying, one thing that we look at is what do you current and former employees say in job review boards? That might be a Glassdoor, it might be an Indeed. We see between the two of these, there's over 11,000 results on those two sites for the exact term health insurance sucks. Whoever it might be a large Fortune 500 company, it might be your large local, or it might be your small local, mom and pop store. You got one, location, 50 employees. People are still going to say the same thing, whether or not it's a large multinational corporation or a local regional firm. 86% of employees, and I thought this was interesting, 86% of employees and job seekers research company reviews. And this is according to research from Glassdoor. So what that means is that employees are Googling you. They're looking up the company. They're assessing your brand, and they're seeing what the benefits are like. So it's not just how much you're paying them, how much you're getting in PTO for them. They want to know what the benefits are like, and that can make or break their decision on whether or not to come to your team or not. So here's some things that people might say. They might say, our benefits suck. Our insurance is really expensive. It costs so much to go see the doctor. I can't go see the doctor when I want or for what I need. And all of this just boils down to saying our health insurance sucks. But what are they really saying when they say that? Let's translate that. If they're saying our benefits suck, they're really just saying, I don't value what we have. Our insurance is really expensive. Well, the premiums and cost sharing is really high. It costs so much to go see the doctor. Well, copays and co-insurance are high. And I can't go see the doctor I want or need, means the network is missing certain providers. And as what we're seeing today is that there's a lot of financial stress already put on employees. With the existing financial stress, health insurance is just not doing its job. It's not delivering value in the way that employees want. So sometimes those features and benefits that we get out of those plans, the things that we like talking about at renewal time, that might not exactly be what employees want to get out of the plan. One of the things that we're really looking at right now is stated inflation from the government is 8%. But if you're paying for gas, if you're going to buy food, whatever it might be more than that. Employees are already financially stressed. So given that there's high inflation, are you planning to give them 8% pay raises this year? Because I can tell you that we're anticipating 10% plus increases from health insurance carriers in Q4. Hospitals and providers are charging more because of inflation. That leads to higher insurance premiums. That means you're going to see increased costs this Q4 and moving forward. And so it's something that we need to be better aware of. And so we just can see that, employees are not getting what they need from the plans that are being offered. They're paying more in premiums every single year. Cost sharing is going up, deductibles, co-pays, and premiums, and more. And so what that means is that employees are just not getting the value out of the plan that they need. Pay raises are just not going to be 8%, as we talked about. So employees are under so much financial stress. And then there's the health insurance plan on top of that. So it's not just the premiums, it's everything else. So a good rule of thumb, something to consider, you might be familiar with NPS or Net Promoter Score. A Net Promoter Score basically is an assessment of your company or product or brand. It asks one question. It says, how likely would you recommend this to a friend or family member? It's on a scale of 1 to 10. If it's 1 to 6, then you're getting a negative. If it's 7 or 8, it's a neutral score. And then 9 or 10 is positive. It's an assessment of, are your employees raving fans of your benefits? Are clients raving fans of your products? Whatever it might be, the NPS of. And that's where I want to use it in terms of benefits. Because if your current employees are not raving about the benefits you have, they're not a competitive advantage. They're not giving you an edge in holding onto your team, recruiting your team, bringing your team in. If you don't feel like your benefits are a competitive advantage in the market, that's going to have a negative effect on you. And so when we talk to employers today and they're talking about how hard it is to recruit, to attract people, why is that? Well, one of those reasons is that your competitors are working really hard as well to hold on to really good people. And so everyone else is out there is trying to bring in a talent. They're trying to hold on to the talent they have. They're also going out and offering the benefits that are going to bring those people in and keep them on board. So we have to figure out how we get a leg up on the competition, just like trying to add new product features, just like trying to add new service lines, just like trying to have some kind of other moat in your business. A strong benefits plan can be that competitive advantage. So again, staying with the theme, why exactly does health insurance suck though? So not just bad, high premiums, high costs and stuff like that, narrow networks. Why exactly sometimes can health insurance suck? What exactly is it about it? So before we do that, quick quiz time. What does health insurance, Cheetos, soda, and potato chips all have in common? Feel free to drop a comment in below. It was kind of fun. I actually personally, I'm a huge Ruffles fan, so it kind of hurt me to put Ruffles in there, but it is what it is. Well, here's the thing. All of these are highly processed products. They've been iterated in hundreds of different ways over decades in ways that have made them just barely consumable for you today based on what the government and regulatory bodies have allowed as the bare minimum. And so what I mean by that, oh, and actually quick fact. So while I was doing research for this a little bit, I found some really insane ads from the past, some stuff that just blew my mind. So Lucky Strike cigarettes had ad slogans such as reach for a lucky instead of a sweet. So trying to help people on diets avoid sweets. They said go reach for a cigarette instead. There was something called the banana and milk diet, suggested to treat diabetes in like the 30s or 40s. And that basically said, have 4 to 6 bananas and 3 to 4 glasses of milk every day for an entire 2 weeks, I think it was. And then the last one was the vision diet, which this is just bonkers. This suggested to people to wear blue tinted glasses because it's based on the idea that red and yellow colored foods are most palatable. And so it was to basically affect our vision so that we wouldn't want to eat certain foods. So there's a lot of weird stuff out there, with food and all of these things. And I also would throw in health insurance there. It keeps it's processed and it evolves over time. And at some point we end up with something that's not really healthy. It's not exactly what we would want. And so in your case, if you're a plan sponsor today, you're providing healthcare through a fully insured health insurance product. You're providing healthcare that's been processed and it's evolved over dozens of different ways, over decades of iteration. So it's kind of a mutated monster, really, in some ways. It's not at all how we would design something from the ground up today, knowing what we know. That's just the fact of the matter. So from a practical standpoint, though, when we say that it sucks, when we say that it's evolved over time, that it's become this just mutated monster, that's not really what we would want from building on the ground up. We have to start thinking about what exactly what are some of those issues? Those includes misreads of what employees want, no focus on prices or quality. There's misaligned incentives just rampant throughout healthcare, and it affects your health insurance. And then just the short-term view that we take when it comes to making healthcare decisions. So for what employees want, there's a few real interesting things here. So the first one is going to come from Centivo. Centivo is a TPA
in the healthcare space. They're working on making healthcare more affordable and accessible. And they had some pretty interesting stuff come out from a research project they did at the end of last year. A couple different slides here. Really, the first one is that people are using credit cards and they're using debt in order to pay for their healthcare expenses. So they're tapping into credit cards, they're tapping into debt lines so they can get the healthcare they need. Well, on the other hand, they're also cutting back on certain household necessities in order to pay for significant medical expenses. What was it? Over 64% of people said they made some kind of sacrifice in order to pay for their healthcare. Some quotes from people in that survey said, I didn't schedule medical appointments for the rest of the year because of their costs. I wasn't able to pay medical bills all at once, so I was reported to collections. These are the things that real people, your employees, are possibly having to do because of the health insurance plan kind of sucking. There are ways we can address that, but the big thing here is that cost sharing, premiums, all of this, it's not doing the good job. It's not accomplishing end goals. If we're just asking employees to pay their share of healthcare expenses, from a behavioral standpoint, they're just sometimes not going to go see the doctor. They're just not going to get things done. They're not going to fill prescriptions. There's research out there that every payday, that's when prescription fills go through. People don't get their prescriptions filled until they have the next paycheck hit their bank account. So many people living paycheck to paycheck. What do you think it does to them having high healthcare expenses, having high healthcare costs, when they're going to pay a couple $100 a month for their health insurance, and then they're still going to have copays? All of those things impact how employees view their benefits. And if that's not a strong benefits offering for your company, if that's not something that employees are viewing as a core aspect of their compensation, of their total compensation, which I know you think of it that way, if employees are having to go out of their pocket to pay for some basic medical expenses, they're not finding value in what you're offering. They're going to believe our health insurance kind of sucks. Additionally, this was so interesting in this. 73% of respondents to this survey said that they were actually willing to sacrifice certain health plan features if, and this is the key word, if they could realize significant savings. The point of this slide, the idea here is to say that sometimes as plan sponsors, we like to add more, right? We see this with employers. They say, hey, I want to add more to my plan. I want to add more. I want to have a larger network. I want people to go see more doctors. I want to make sure we get this new, this certain hospital in the network. By adding all of those different features in, it increases the price, right? Certain hospitals and certain providers might not be in certain networks because they're expensive or they might have low quality measurements. So if we add them, that's just going to increase the cost of the total plan. That's pretty straightforward. Well, employees, the number one thing they're focused on is the cost. If they're paying $300 a month out of pocket for their health insurance plan in order to have access to 3 times as many doctors, and they're not going to go see all of them, they really need to have a couple key physicians depending on what needs they have, versus being able to save some of that money, having a $50 or $100 contribution per month. That can make a really big difference for employees. It changes how they feel about their benefits. And finally, this is a really key thing, because with where we're headed, it seems as if small group health insurance premiums are going up here for the next couple of years because of a variety of things, including inflation, medical cost trend, specialty drugs that are coming on the market and costing a lot. And this isn't just our word. I know that COVID has kind of lulled us to sleep, and this is just the fact of the matter. When we talk to groups today, we're hearing, oh, our last couple of renewals weren't that bad. Our carrier gave us a decrease, in fact. And I can say the same thing. Some of our fully insured groups, they got decreases last year. It's because people didn't go to the doctor in 2020. 2021 renewals weren't bad. 2021 usage, again, wasn't that high if your group renewed earlier this year. But talking to some carriers, one large carrier, in fact, told us to expect 12% increases, 12% renewals in Q4. So that's coming at some point. I frankly think that we're going to be scrambling towards the end of this year because a lot of groups are going to start getting these renewals. They thought, hey, you know what? I got a 2% increase in 2020. Maybe last year I got a 3% decrease. I think I'm sitting pretty good. You might be looking at a 10 to 15% increase this year, if not more, possibly depending on your claims, possibly just depending on generally where healthcare expenses are going. Like we talked about, inflation is 8% stated. It's probably higher than that in healthcare, which has already been growing at a faster rate than the general inflation rate. So you're going to have to spend more on health insurance premiums. We know that. The question is, how are you going to start controlling that? Because if you don't control it, it's just going to keep increasing. As we've already talked about, it's a huge financial strain on employees. Part of that is that the healthcare prices are just too damn high. Healthcare prices are so unattached to quality in this country. It's a huge thing. A lot of economists have already looked at this. I personally, I really like Uwe Reinhardt. I thought he's a really interesting guy. He's a Yale health professor. He's helped design national health systems. One of the things he just talks about, it's the prices. We pay a lot for healthcare. And you don't even know it sometimes. Your employees don't know it. An employee might need to get an MRI. They have no idea what the difference is between going to a local facility, going to an ambulatory surgical center if that'll, or imaging center if that'll do it, or just going to the hospital nearby. It might just be easy to go to the hospital. Well, that hospital might charge $3,000 for that MRI. They could just go to an imaging center nearby for 300, 500. That difference in cost, you're paying as the group. So if your premiums are increasing year over year, think of it as partially, it's because employees are given a credit card. They're allowed to go to the mall. They're going to buy what they want to buy. They're going to consume what they want to consume, but they don't know how much things cost. And at the end of the day, you're the one who's going to get that bill. And so you're not able to be proactive. You're not able to have eyes over these things. Imagine with your supply chain, if you didn't know how much stuff cost before you bought it. I imagine an auto dealer trying to sell cars and they're setting a price before they knew what they were going to pay for those costs. You can't do that if you don't know the cost of your goods that are being sold. It's the same thing in healthcare. We don't outperform other countries. We don't oututilize other countries. We just pay more for the same services. That's across the board in most aspects of our healthcare system. One thing to keep in mind is why when you go to the hospital, you see shiny marble and beautiful new cancer wings, but declining investments in primary care, in internists and general practitioners, it's not where the money is. So we got to think about that. As employers, you have to understand that in our country, 160 million people get healthcare coverage, health insurance from their employer, from employer-sponsored plans. You're paying for those allocations, those investments at those health systems because of the way you're funding your health insurance plan. And if you're doing it in a way that's not efficient, your plans are probably going to kind of suck, as we've covered, and it's going to be a waste of money. Additionally, RAND is it's a think tank out of Santa Monica, out in California. And they've got some really interesting research. They've done a lot of comparative studies on private plans paying for healthcare services, the prices they pay compared to Medicare prices. The recent research from about a year or so ago looked at research from a few years ago, and it found that private US health plans paid hospitals 247% of what Medicare would pay. Well, recent research came out and it basically backed that up. The top line number was a little bit lower because of some funky things in the study, but we don't need to go into that. You're not a health economist, you're a plan sponsor, you're an employer. Recent research, though, found that those health systems that reported in both study years, their prices were about the same. It was still about 245 to 250% of Medicare. It's worse, actually, for those of us in California. Private payers are paying 269% of Medicare in our state. And so that shows you that those prices, hey, doctors are charging certain amounts for doctor's visits, for surgeries, or for whatnot under Medicare. Hey, but if that employer is the one footing the bill, if it's an employer on the medical ID card, those prices are going up. There's not many other industries where the identity of the payer so significantly affects how much is spent. Part of that then, by not having a control on this, by not having a collar on this, increases health insurance premiums. Additionally, misaligned incentives create just really tough issues in health insurance. There's a great quote from either Warren Buffett or from a gentleman named Amarilla Slim. Look around the poker table. If you don't see the sucker, you're it. And quite frankly, as we talked about, 160 million Americans are getting health insurance from an employer-sponsored plan. Those private payers, you as the employers, you're the suckers at the table in the healthcare system. You're spending about $1 to $1.5 billion a year in healthcare costs, and a lot of groups don't know where that money is exactly going. You're writing a check every single month, you're getting an ACH debit just to a large carrier. You have no idea where the money is going, what it's paying for, what quality you're getting, or if it's going to waste. Part of what that money is going towards are the significant growth that we've seen in the health insurance carriers. Now, I don't want to seem like I'm bashing on health insurance carriers. Health insurance carriers are very valuable for us, especially for the smaller groups that really need the insurance provided by those carriers. The bundling of everything is very helpful for certain groups. For a lot of groups, they need to understand the bigger picture here. The big picture is that 7 health insurance CEOs brought in $283 million last year in compensation. 7 health insurance CEOs. That's an average of oh gosh, I don't even know, but that's just, you can just see that with these health insurance carriers, they're making a lot of money on this care. It's about $40 million per person on average. Some of that's cash compensation. A lot of that is going to be stock options. So you can see there that for those health insurance carriers, their stock prices have increased significantly. Last year, previous year, really in the last 12 years since the ACA, a lot of carriers have seen their values triple to quintuple based on the increasing health costs of the country, leading to increased health insurance premiums, leading to increased margins. So you have to understand health insurance can kind of suck because health insurance carriers are looking out for themselves and their shareholders. Their fiduciary duty. Their job is to make money, increase earnings per share. It's not to offer you less expensive health insurance. Offering less expensive health insurance would lower their profits, lower the value of their companies. So you need to understand health insurance companies are not in the business of offering you really good health insurance. They're in the business of making money. In certain cases, that's okay. A lot of cases, though, we think you can do a little bit better. One of the things that we think really fixes misaligned incentives is working with local health systems. So this is just something to put a pin in. I heard this recently from someone for a health system. I thought it was really, pretty succinct and to the point. Is that they said healthy and happy patients are healthy and happy employees. There's an alignment here because health systems want to take care of people. They want to lead to healthier people in the community. They want to increase people's health. They want to increase their medical adherence. They want to decrease their their chronic conditions and all the symptoms and stuff like that. Partnering with your local health system can have real impacts on your employees' health, but also on the healthcare prices that you're spending. That's a pretty interesting thing, and we're going to talk about that a little bit more. But we've seen this come up before with Disney, with Boeing, and that was with Moral Care here in our backyard. And then as well, Henry Ford signed a plan with a group out in Michigan. So this shows up across the country, and it's coming down system, frankly. A lot of innovation in most industries starts at the top, starts at the biggest companies, starts filtering its way down. And that's what we're seeing right now in this space. Finally, the short-term view of health insurance is just debilitating. It's leading to health insurance that sucks. So let's say you're a group and your total health insurance premiums for the year last year were $600,000. Let's say you're getting a 5% increase, so your premiums are going to be $630,000 next year. Well, all right, 5%, it's not the end of the world. Maybe we can eat some of that. Maybe we'll increase deductibles. Maybe we'll pass some of that on to employees. You might not think it's really the end of the world, but here's the thing. In the big picture, after 10 years, at that same 5% growth rate, you'll have spent nearly $7 million on health insurance premiums. $7 million over 10 years is an investment in something that isn't an investment. I mean, you have to determine that. You have to assess whether or not your health insurance is something is it an asset of the business? Are you using this to proactively go out and bring in people that you're trying to recruit and retain? Or is it kind of an afterward? Is it something that you mention kind of under your breath as you're leaving that meeting with someone that you're trying to bring on? Is that chief of sales officer, that COO person that you're needing to take the company to the next level? Are you leading with the benefits, or are you kind of apologizing for them and trying to work around them? If it's the latter, it's something to think about because it doesn't have to be the case. And it's not carriers. Again, I talked about carriers. Carriers, it's not in their best interest to care about the next 10 years of your health plan. Carriers are only offering a 12-month contract. So they're looking at the next 12 months. They're saying to you, Mr. Employer, ABC Manufacturing Company, I know I'm going to have you for the next 12 months. That's all I care about. I care about managing costs, making sure that you've got a good experience, but we're not worried about the long-term health of your employees. They're going to be a year older next year. We'll reprice it. We're just going to charge more because everyone gets older, everyone gets sicker. That's just how it's going to work. On your end of things, though, as a plan sponsor, if you're the one offering these benefits, how long have you been offering benefits for? How long do you plan to offer benefits for? So what kind of game are you playing? There's an adage out there that the person with the longest time horizon is usually going to be the one who wins. If you can play a long game, you can make investments, strategic decisions that pay off. But if you're just going to bounce year to year from plan to plan, it's not going to be as effective for you. So, as Michael Scott says, it's time to turn the tables around. It's how to turn tables. So one of the things that we look at, we want to see with these kinds of things, the way to make health insurance suck a little bit less is to help employers gather transparency and control, because doing that allows you to be strategic. It allows you to make investments. It allows you to assess interventions, see if they're working, see if they're not working, and make those changes. And you do that year over year. And just like we talked about, evolving and iterating on something, it can be negative because it might lead to Mountain Dew and Ruffles and current health insurance, or it might be productive. It might be a better and better process that enhances your plan's offering. It enhances the value of working for your company. Because we see that with a lot of employees now. They're asking about the benefits. They want to know what you're offering. They want to know how it impacts them and their family. And so for us, offering health insurance that doesn't suck, a high performance health plan, if you want to call it that, it's going to be based on a few different things. Instead of just giving employees essentially a credit card that they can go use wherever they want, when they want, we're going to think about healthcare a little bit more as an overall structure, right? We're going to think about how we are helping employees get the most out of the healthcare that they are consuming. It's going to start with primary care. There's going to be the need for specialists in a plan, and then there's also going to be the need for acute care. And so in each of those, we're going to want to assess the right economic model for us to fund that, for us to deliver that to employees. With primary care is a huge area right now because we're seeing this really interesting transition to virtual care with in-person care. We've talked a lot about, and you've probably seen this ad nauseum, about telehealth over the last couple of years through the COVID pandemic. I don't think that we're going to see telehealth utilization completely fall off. I think is what we're going to see is this marriage between the virtual and the in-person care. There's a lot of ways that we can use both of them together in a way to decrease costs, help employees be better consumers of healthcare, figure out the entry point for them within primary care and telehealth. Because we know statistic and from a research standpoint that integrated care, that marriage of virtual, in-person, primary care, mental health, chronic conditions, and more, all of that decreases total costs and delivers better value to employees. So if an employee comes on board, they're struggling to see a doctor, they're struggling to get an appointment because it's 2 months out, they're not getting treatment for their chronic conditions, whatever it might be, what's going to be their perspective on the health plan? Conversely, if they come on board and they're immediately able to download an app that has an integrated platform of specialists and primary care providers to figure out what's going on with them, direct them to the needs they have, and if they need in-person care, finds the lowest cost provider nearby with the highest quality scores, sends them there. How much more effective do you think that is? How much more valuable do you think employees see that? So again, it's going to cover primary care, mental health, chronic conditions, and more. This is where the direct contracting comes up because we might say, hey, you know what? We know a certain health system in your neighborhood has high quality measurements, has lower prices. What if we go to that health system and say, hey, you know what? ABC Manufacturing, XYZ Services Company, they got 100 employees in the backyard. Can we send them all to your hospital if, and only if, you're going to give us a 15 to 20% discount off of the rates that we're getting from our health insurance carrier? A lot of health systems are playing that game nowadays because they are in the business as well of driving patients through the door, feet on campus, visits. They're looking for these opportunities. We want to take advantage of that. We want to be the ones who, again, turn the tables around. We are the ones who are consumers. We're the ones buying from hospitals. We should be dictating more of that conversation. Next up, specialists. Specialists are a really important part of plans because they impact a lot of different ways that employees consume and pay for healthcare. Again, I go back to that mall example. Employees have a credit card. They're going to see specialists. How do we know which ones are the best ones to use? How do we know which ones are going to be the least expensive to use? We want to steer employees to high quality specialists with data and plan design. So we want to get rid of those providers who are high cost. They kind of suck. And we see this in statistics, right? There's Medicare research out there on certain providers who just, you know what, everyone who comes in the door, getting a back surgery, getting a knee surgery. They're getting the highest cost intervention possible. They're not starting with lower cost interventions that might even have better outcomes for employees. It's going to cut waste, things like extra MRIs and certain tests that we just don't need. And then additionally, I think this is a really interesting area nowadays for a lot of companies that are more forward thinking and looking for inclusive opportunities in their business, is that within specialists, that's where we can target certain specialists who have, they're going to be the best kind of providers for certain populations. And this is a way as an employer to show you're inclusive. So examples that come up include LGBTQ and minority populations. Statistically, all the research shows that they have a much worse time engaging with the healthcare system overall. They experience countless adverse outcomes as a result. If it's mental health, if it's chronic conditions, if it's pain management, if it's maternal care, whatever it might be, if you believe yourself to be an inclusive organization, I think that you have to show with your benefits. if you're putting out DEI statements, if you're putting out news reports or press statements about, some statement you've made at a corporate level, but your benefits aren't going and looking for ways to be more inclusive and give employees the right access points for what they are trying to get out of the healthcare system, I don't think you're really, frankly, matching. You're not walking the walk. You're just talking it. Employees are listening. Employees want to see this. Even if employees don't identify in certain ways, they'll still notice if you're not being inclusive, right? Inclusive is no longer just something that people are noticing if it affects them. They're noticing how their peers are affected. We're a little bit more conscious as a society of these things. Finally, within acute care is things like cancer treatment, other certain kinds of chronic or terminal diseases. Those typically are using point solutions and COEs. A COE is a center of excellence. That's where, again, we're finding that high quality provider. We're driving a lot of our utilization there for decreased prices, better outcomes. Something that comes up, for example, could be MSK, musculoskeletal cases. Well, maybe we want to work with a Hinge Health. Maybe we want to find someone who's a leading digital health provider in that space who can give you better pricing, get you better outcomes, decrease your total costs. Could be something on the cancer side. Maybe you need to find certain vendors in that space to assist. Finally, it could be high prescription drug costs. With formulary and strategy out there with your PBM, there's a lot of ways to manage that. We'll see some companies, they might have 50 employees. Well, there might be a high cost drug on their formulary. We get rid of that. We do things to alleviate that, still get employees what they need. Your cost could go down $100,000 to $200,000 a year because some of these drugs are so expensive. A fun little exercise is if you're watching TV and inevitably you're going to see a prescription drug commercial, pull up goodrx.com, type in that drug, see what it costs. You might find, wow, okay, so our employees might just be spending $50 a fill, but this drug is costing us $6,000 a month, $10,000 a month. That's a pretty big deal. For a lot of groups, that's a huge component of their spend. It's why we see in some groups, they might have 1% of their employees are accounting for 50% of their costs. So for the rest of those 99% of employees, what are they getting for their health insurance? It's where we believe that you have an obligation, opportunity as an employer to deliver health insurance that doesn't suck. I personally think from a business standpoint, it makes a ton of sense. It gives you a competitive advantage. If you're going out there and creating raving fans of your company in the form of employees who know that the benefits are delivering value to them, it's giving them what they want, and it's not creating a financial crunch on them, that's highly valuable. That's going to make a really big difference for you in recruiting and retaining the team that you need in order to win. The perspective we take on this is we want to help groups refinance their health plans in order to enhance their overall benefits value and benefits offering, and then use that to go attract and retain the team that they need to take their business to the next level. That process includes discovery, includes implementing strategies, and then assessing those, and then creating this flywheel, this iterative process that over time just keeps improving your plan. Year over year, we should keep making improvements to the plan so that it looks completely different from maybe it did 5 years ago, because you keep making these improvements. You keep finding new ways to add value for employees, but still manage costs. At the end of the day, follow a process. If we're going to bounce year to year to different carriers, your health insurance is going to continue to suck. It's going to continue to be just a cost center in your business. If we follow a process, we think there's a lot of opportunity for the right company out there to make benefits a competitive advantage, help them offer health insurance that doesn't suck, and get an edge in their business. If you've got any questions, please drop them in the chat. But until next time, thanks for joining. And again, apologies about the technical difficulties earlier. But hope you learned something from this. Before you go, feel free to drop in a comment on what you learned, and keep an eye out for the recording. And we'll be in touch soon. I'll stay on here if any questions come up. All right, not seeing anything come in, so I'm going to close it out. Thanks, everyone. Have a great one.